Hello and welcome to Nclex Made Simple YouTube channel. Here we prepare you for the Nclex exam by giving you content that is relatable and easy to grasp for the preparation of the Nclex. Today we are going to tackle cystic fibrosis. This is one of the conditions that Nclex love to test under pediatric genetic respiratory condition. So we are going to look at it today and try to understand what it's all about. So cystic fibrosis is a recessive genetic disorder that affects mostly the lung, but also it can affect the pancreas, the liver, kidneys, skin, and the intestines. Cystic fibrosis is an inherited disorder where mucus, sweat, and digestive juices are sticky and thick instead of being slippery and thin. Now, due to their thick and sticky nature, these secretions are unable to act as lubricants and end up instead blocking the ducts, passageways, and the tubes. So the end-stage lung disease is the main cause of death. Cystic fibrosis affects exocrine glands. An exocrine gland is a gland that makes substances such as sweat, tears, saliva, milk, and digestive juices and release them through a duct or an opening to a body surface. Examples of exocrine glands include the sweat glands, the lacrimal glands, the salivary glands, the mammary glands, and the digestive glands in the stomach, pancreas, and the intestines. So cystic fibrosis is caused by defects in the cystic fibrosis gene, and an individual must inherit the defective copy of the cystic fibrosis gene, one from each parent, to have cystic fibrosis. We are saying it is a recessive autosomal disorder, and one must acquire one defective copy of the cystic fibrosis gene from each parent for you to have cystic fibrosis. The mutations to the cystic fibrosis transmembrane conductance regulator CFTR gene, they prevent the electrolyte chloride from moving to the surface of the cells. And if the chloride cannot attract water to the cell surface, this leads to thick, sticky mucus that builds up in the lungs and pancreas, increasing the risk for lung infections, inflammations, and complications with the nutrition and digestion. The thick and sticky mucus clogging the airways is a defining characteristic of cystic fibrosis. It's the hallmark sign. The buildup of mucus also prevents the release of the digestive enzymes from the pancreas. We have digestive enzymes such as protease, amylase, and pancreatic enzyme insufficiency and impaired enzyme secretion leads to impaired digestion and absorption of these nutrients. There will be malabsorption. In cystic fibrosis, there is increased viscosity and tenacity of mucus. This is all what we are saying. That there will be increased viscosity. Those are the terms that can be used in the exam. And tenacity of mucus produced at the epithelial surfaces. The patient also has high sweat, sodium, and chloride concentration, causing the sweat to become very salty. Secretions in affected organs become thick and viscous, obstructing the glands and the ducts. The signs and symptoms of cystic fibrosis vary, often depending on the severity of the disease. In the respiratory system, there is persistent cough, often producing thick mucus, frequent lung infections leading to chronic bronchitis or pneumonia, and wheezing or shortness of breath. In the digestive system, there will be poor weight gain. Remember, the digestive enzymes are not being released. They have been blocked, and therefore the nutrients are not being taken up by the body. So the child will not gain weight. The client will have poor growth. That is what we normally call failure to thrive in infants and in children. There will be steatorrhea, that is fat, smelly stools that are greasy in nature. The steatorrhea will be due to poor absorption of nutrients. Intestinal blockage, particularly in newborns, is also known as meconium ileus. You can find a question mentioning meconium ileus, and this is particularly a sign of cystic fibrosis in newborns. Salty tasting skin. Parents often notice that the child's skin tastes salty when kissed. They can taste the salty sweat on their skin. Other additional symptoms are like nasal polyps and sinusitis, clubbing of the fingers. Clubbing that is the enlargement and rounding of fingers and toes. There will be fatigue and reduced exercise tolerance. In the male reproductive system, most males with cystic fibrosis are infertile due to obstructed or absent vas deferens. Cystic fibrosis can lead to infertility. Other complications will be diabetes, liver disease, and bone thinning, known as osteoporosis. So you look at those two images illustrating signs and symptoms of cystic fibrosis. The first image, you can see frequent sinus and lung infections. There'll be nasal polyps, greasy bulky feces, very salty tasting skin, and persistent coughing with mucus. The other one, it's also an addition, the fatty bowel movements, trouble digesting food, abnormal pancreas function, gallstones, enlarged heart, trouble breathing, salty sweat, nasal polyps growth, sinus problems, there will be sinusitis, and frequent lung infection. So those two images can give you a very clear overview of what happens with cystic fibrosis. The diagnosis. How do you diagnose cystic fibrosis? Number one is through sweat chloride test. This is the most definitive test for cystic fibrosis. It measures the amount of chloride in the sweat. High levels of chloride suggest cystic fibrosis. There is also genetic testing used to identify mutations in the CFTR gene. This is particularly useful for confirming a diagnosis following a positive sweat test, all as part of the newborn screening program. So in newborn screening, in many places, newborns are screened for cystic fibrosis using a blood test. This looks for elevated levels of immunoreactive trypsinogen, IRT, an indicator of cystic fibrosis. Chest x-rays and CT scans are done. Pulmonary function tests. These tests assess the lung function and are often used to monitor the disease progression rather than for initial diagnosis. Chest x-ray and CT scans are imaging tests that can identify lung infections and other abnormalities associated with cystic fibrosis. Stool tests, these can be used to evaluate fat absorption, which can be impaired in cystic fibrosis due to pancreatic dysfunction. Remember, pancreas is the one that produces the digestive juices to help in digestion of fats. So stool test is important to evaluate fat absorption during the course of treatment. Sputum test, analysis of sputum can detect lung infections common in people with cystic fibrosis. Goals of management of cystic fibrosis. It is good to note that cystic fibrosis has no cure, and the goals for treatment for this disease include: 1, preventing and controlling lung infections; number 2, loosening and removing the thick, sticky mucus from the lungs; number 3, preventing and treating blockages in the intestines. Next is providing adequate nutrition. This is very, very important. They need a good diet, high calorie diet, high protein diet, with unrestricted fat content. The other goal is to prevent dehydration, encourage appropriate physical activity, and promote a reasonable quality of life for the client and for the family. The management includes administration of antibiotics, Bronchodilators and mucolytics. That's when we give nebulized hypertonic saline. It helps with the improvement of symptoms of this disease, especially the respiratory symptoms where we have thick mucus obstructing the airways. Pancreatic enzymes are given before meals and snacks. This is to help with the digestion. This condition affects the pancreas and they are unable to produce or secrete these digestive juices. So you need to give supplemental pancreatic enzyme therapy, and this is given just before you take the meals and snacks. Vitamins, very important. Also, the patient can be on long-term anti-inflammatory therapy that such as NSAIDs. For example, we have Brufen, supplemental oxygen when they are now having difficulty in breathing. Lung transplantation is the last resort. That is whereby you remove part of the lungs or the whole lung from a donor and you replace to help with breathing. Patients with cystic fibrosis usually develop diabetes mellitus. They are on insulin injections, so the patient even will be given teaching about it. Cystic fibrosis transmembrane conductance regulator. That is a medicine for the cystic fibrosis. Let us now look at the nursing management. What do you teach the family and the patient? Teach the family and the patient. Children with cystic fibrosis may be less inclined to follow diet and enzyme guidelines. So children should be encouraged to eat anytime they feel hungry. They should not follow a certain routine for meals. They should be encouraged to eat anytime they feel hungry. Adhering to set meal times may not be feasible, and flexibility should be encouraged. Involve the child in taking their enzymes by opening those capsules or sachets and sprinkling the beads on their food. Let them be involved so that there can be good compliance with taking of these enzymes. The other thing is collaborate with a dietitian. Dietitians can assist with finding the correct amount of enzymes required, as well as recommending addition of vitamins and supplements and adding calories to the diet. The next thing is administer bronchodilators. Bronchodilators should be given before hypertonic saline, as these will open the airways and make coughing up mucus easier. So you give bronchodilators before the hypertonic saline. So administer mucolytics. Hypertonic saline is commonly given inhaled. It's nebulized and thins the mucus. Guaifenesin is an expectorant. Will help cough up the mucus. Implement infection control precautions. Strict hand hygiene practices should be followed, and nurses should wear gowns and gloves when in the presence of cystic fibrosis. Implement infection control precautions. Strict hand hygiene practices should be followed, and nurses should wear gowns and gloves when in the presence of cystic fibrosis patients to prevent transmitting germs. Cystic fibrosis patients require single patient rooms, and when multiple cystic fibrosis patients are in a clinic together, they should be at least 6 feet apart. Assist with airway clearance. Airway clearance techniques should be performed last after bronchodilators and mucolytics are administered, as the techniques will likely be more effective. So you administer bronchodilators, you administer mucolytics, then you start the airway clearance techniques. The nurse can assist respiratory therapists with techniques such as chest physiotherapy. The other thing is position accordingly. Proper positioning makes a huge difference in clearing the airways. Chest x-rays can help determine where the secretions are in the lungs, so the patient can be positioned appropriately for the mobilization of mucus. If secretions are in the upper lobes, supine position is the optimal. If they are in the middle of the lower lips, do a high pholas position, which is best for the management of this condition. And if it is in the right or left lungs, the patient should lay on that side. Administer pancreatic enzymes. We have said pancreatic enzymes help the body digest carbohydrates, fats, and protein. These should be taken before eating to aid in digestion. Provide a high protein, high energy with unrestricted fat diet. Patients require high calorie and high protein diets. Encourage dairy, breaded meats, peanut, butter, pasta, and eggs. Encourage exercise. Exercise is often difficult for patients with cystic fibrosis to tolerate. Aerobic exercises help with atelectasis and the clearing of secretions, and research shows frequent exercise improves mortality. So exercise is important, should be encouraged. Administer antibiotics. IV antibiotics are the standard of care for many of the infections that plague cystic fibrosis patients, which are often lung infection. Then the other thing, closely monitor blood glucose and HbA1c, glycosylated hemoglobin, every 3 months. Monitor blood glucose and HbA1c every 3 months. The other thing is the patient should receive vaccination. CF patients should receive the same immunization all children receive. They are more susceptible to influenza and respiratory infections and should receive the annual flu vaccines and COVID-19 vaccines. Assist to cough, deep breathe, and use assistive devices. Provide endotracheal suctioning using aseptic technique as ordered. Help with anticipatory grieving. This is a condition that usually leads to an early death in children. So spend time with the client and family, answer their questions honestly, encourage the family to express their feelings, fears, and concerns, and encourage use of support systems such as spiritual groups and social groups. Discuss advanced directives. Advanced directives is the living will and the power of attorney for healthcare with the client and family. Now we have come to the end of the cystic fibrosis. It was a quick one, and now we are going to look at the Nclex style questions. This is just to test your knowledge on the disease cystic fibrosis. So far what you have learned, and I'm sure you can be able to answer most of these questions correctly. So take your time, read the question. We have also provided the answer with the rationale to help you and have a deeper understanding of this cystic fibrosis. So see you again next time in our next video. If you have not subscribed, kindly go there and subscribe to our YouTube channel. When you do so, you will be getting notifications when we upload these videos. You'll be the first to get these notifications when you upload these videos, and it is my sincere hope that these videos will be of great impact to you as you prepare for your Nclex exam. Thank you.